We estimate that the backlog has grown in effectively every area that we monitor.
Doctors Manitoba estimating the backlog for surgeries and diagnostic procedures in the province is at an all-time high.
Our latest estimate suggests that the backlog has reached nearly 168,000 cases, which is up 6,300 cases from last month's estimate.
A closer look at the numbers announced today estimates that there are 54,820 surgeries still in backlog, up 2,493 over last month's estimate. 45,251 diagnostic imaging procedures, up 2,762 cases, and 67,816 other diagnostic procedures, such as endoscopies and mammograms, an increase of 1,047 cases over last month.
It's impacting thousands of Manitobans, likely over 10% of our population. Each case is a person. It might even be one of you. And if not, they're our neighbors, our friends, our family, and our loved ones.
Dr. Thompson says he is encouraged by the province's Diagnostic and Surgical Recovery Task Force. He says in a recent town hall between the task force and Manitoban physicians, ideas were floated about how to chip away at some procedures like echocardiograms by having them completed outside of the hospital setting, but says these are temporary fixes and more capacity needs to be added to Manitoba's healthcare to really tackle this backlog, which he predicts will take years to recover from.
We're encouraged by the recent updates from health system leaders suggesting that surgical volumes are returning to normal in many hospitals. New capacity must be added to help those Manitobans who are still left waiting in both pain and uncertainty.
Minister of Health Audrey Gordon says significant progress has been made by the task force, saying more details will be coming next week.
We've got physicians, nurses, frontline workers, business analysts, individuals that are working in many different areas to ensure that we're able to have contract talks and increase capacity within the system and as well outside of the system.
Doctors Manitoba is calling for transparency from the province, increased capacity in Manitoba's healthcare system, and an official target date to complete the backlog.
It's hard to believe that she's going to come out next week and provide the update that includes an end date to this backlog. Time and time again, we've seen this Premier, this Minister of Health, come out and provide nothing but empty promises, broken promises, empty commitments, and just sort of delay, and deflect.
In Winnipeg, Mike Albanese, City News.